Thank you. Thank you, Mr. Chairman. I appreciate it. I appreciate this opportunity to ask a question. I want to go back to the question about antibiotic drugs. The FDA's job is to protect public health, and a big part of that is making sure that drugs are safe, that they work. And we've been talking today about how the FDA does this work for drugs that are used in animals, and I want to focus on how the drugs used in animals can also affect human health, and this is about antibiotics. Antibiotics are obviously extremely important for treating bacterial infections, but as we know, they are becoming less and less effective. Today, resistance has been seen to almost all antibiotics that have been developed. The CDC estimates that 2 million people in the U.S. Develop antibiotic-resistant infections every year. That results in about 23,000 deaths and adds about $20 billion in healthcare costs to our already overburdened system. Antibiotic resistance, we know, comes from the overuse of antibiotics, and not just overuse in humans, but overuse in animals. So, Dr. Solomon, can you just get me started here by saying a word about how the use of antibiotics in food animals can lead to antibiotic resistance in humans?
So thank you for the question. So the process is giving antibiotics to animals may cause certain resistance in those animals, if in the gut of those animals, if on the process of those animals being slaughtered, that resistant bacteria gets on meat, and then people consume that and it's undercooked, they may be able to get that resistant microbe, or simply people that are handling the animals.
On someone's hands?
Hands.
Yeah. Uh-huh.
So, I mean, we see problems. We have a current problem with people feeding raw pet food to their animals. And unfortunately, 2 children got very sick because that raw pet food, as many raw products, had salmonella in it, and they've got very ill. So handling raw products like that can get them exposed.
So it matters if animals become antibiotic resistant or have antibiotic resistant bacteria, and that then moves over into humans and threatens humans. Now, I know that the FDA has taken a lot of steps to address this issue, including requiring veterinarians to supervise all antibiotic use in animals. And this was meant to make sure that food animal producers use antibiotics only when it is medically necessary, like when the animal is sick or there is a risk of disease, and not use antibiotics just to grow the animals faster. The 2008 ADUFA reauthorization also required the FDA to collect data from drug manufacturers on the amount of antibiotics they sold for use in animals. Dr. Solomon, these data tell us how many antibiotics go out the door from the drug company to the farm, but do these data tell us how and when those drugs are actually used on animals?
They do not. Right now, this is sales data, and how that equates to actual usage data is data that we're still trying to collect. We're working with USDA and doing some of our own contract work to try and better understand the actual usage data and making sure that everyone's following judicious use principles.
Good. So I'm glad to hear that you're trying to get better data. In March 2017, the Governmental Accountability Office made several specific recommendations for ways to improve this kind of data collection by the FDA. The GAO also recommended that the FDA work on establishing duration limits on drug labels for certain antibiotics used in animals, in other words, limits on how much of an antibiotic can be used in an animal and for what specified time. Along with Senators Feinstein and Gillibrand and colleagues in the House, I followed up with a letter to then Secretary Price about the department's work to implement those recommendations. I never received a response to that. So, Dr. Solomon, I'd like to follow up directly with you and submit some written questions for the record after this hearing about your progress on the GAO's recommendations. Will you commit to answering those questions?
Yes, we'd be delighted to work with you and get answers to those questions.
Good. I do appreciate it. I look forward to hearing more from you about how you're responding to the GAO's recommendations and in trying to track your progress on this issue. With 2 million people in the United States developing antibiotic-resistant infections every year, it's clear that more work needs to be done, and I look forward to continuing to work with the FDA to build on its earlier policies to collect better data and to make sure that we have more careful use of antibiotics. Thank you.
Thank you.
And thank you, Madam Chair.